This unit will cover ethical considerations in genetic testing. The expected learning outcomes for this unit include understanding the importance of informed consent in any medical procedure, but also as it specifically pertains to genetic testing. We'll also learn about current laws that protect our genetic data, and we will learn about the different types of genetic testing and the ethical concerns that are raised by each. With the improvement in our ability to sequence DNA faster and cheaper, genetic testing has become more widespread. There are several types of genetic testing available today, which include diagnostic testing. This is testing that's used to establish or confirm a specific type of diagnosis. This includes things like prenatal or newborn screening, which determine if a fetus or a newborn is affected with a specific type of genetic disorder. There is also carrier testing. This is a genetic test to screen adults to determine if they carry specific genetic variants that they may pass to a potential child. In performing these carrier screening tests, the risk of having a child with that specific genetic defect or disorder can be calculated. Next is predictive testing. These are genetic tests to determine if a currently asymptomatic or an individual that's currently displaying no symptoms will become affected with a specific genetic disease in the future. And finally, a genetic test that has been gaining popularity in recent years is the direct-to-consumer genetic tests. These are genetic tests that give you ancestry or health-based genetic information with reports that are given directly to the consumer. These genetic tests are usually done by large companies such as Ancestry.com or 23andMe. Obviously, the ethical concerns that are raised often depend on the type of genetic test that is being performed. Now, we'll talk about each of these individually as we move through this unit, but first, let's touch on this idea of informed consent and the laws that are currently in place to protect your genetic data. An informed consent is when a healthcare provider explains a medical procedure or treatment to a patient before they agree to it. The concept of informed consent is required for most medical procedures, including surgeries, transfusions, vaccinations, and the specific tests that we're talking about today, genetic tests. Informed consent includes 5 key aspects, including understanding the nature of the treatment, possible alternatives to the test being conducted, the risks involved to the patient, and the benefits that the test will provide. And obviously, this provides the patients the opportunity to ask the medical professional any questions that they may have about the test. This idea of informed consent also applies directly to genetic tests as well, where the patient needs to fully understand the procedure that's taking place, the benefits and limitations of the genetic test, and the consequences of that test. Also central to the ethics of genetic testing is the idea of privacy and confidentiality of genetic information. People often worry that this genetic information can be used to predict your medical future, and this information may be used by for-profit entities like insurance companies or employers to make specific decisions. Another interesting ethical question raised is who should have access to that genetic information? This is an interesting question because while genetic information is uniquely our own, we can also use that information to gain insights about people we're closely related to. Also, historically, genetic information has been used to stigmatize certain individuals. The poll to the right illustrates the level of distrust people have with certain entities sharing their genetic data without their permission. We can see quickly that about 83% of people are moderately concerned or very concerned that for-profit companies will sell genetic data without their knowledge. This actually might be expected, a certain amount of skepticism towards for-profit entities, but you might be surprised to learn that about 70% of participants are at least moderately concerned with medical researchers and doctors sharing their information as well. Another question from a similar survey: how much do you trust each of the following to have access to your genetic test results? We can see the results here. Generally, as we move down the list, we can appreciate that people tend to put the most trust in medical doctors, your spouse, or even researchers studying genetics. But we see a noticeable shift when it comes to trusting law enforcement, insurance companies, and employers with that genetic data. In recent years, U.S. administrations have begun to build in specific protections related to genetic data. The first is known as the Genetic Information Non-Discrimination Act. This act was signed into law in 2008 and has many protections against the use of genetic information to discriminate in health insurance and employment. These specific protections include prohibiting using a person's genetic information in setting eligibility or premium contribution amounts in health insurance, prohibits health insurers from requesting or requiring that a person undergo a specific genetic test, prohibiting the use of a person's genetic information in decisions such as hiring, firing, job assignments, and promotion, and prohibiting requesting, requiring, or purchasing genetic information about an individual employee or family member. Another protection is that the Health Insurance and Portability and Accountability Act of 1996, or HIPAA as it's more commonly known, was amended to protect genetic information. If you're unfamiliar with what HIPAA is, it is United States legislation that provides data privacy and security provisions for safeguarding medical information. The updated HIPAA regulations now includes genetic information as protected health information.